Talk on tuberculosis in healthcare workers (SCW), a critical public health challenge. My talk is a balance between the evidence-based information, real-world example, and actionable recommendation. Tuberculosis in healthcare workers, a critical public health challenge. So, in introduction, I am Dr. Rajendra Nanavare, chest physician with extensive experience in tuberculosis, clinical and administrative management and research. So today we will discuss a critical but often overlooked issue, the tuberculosis in healthcare workers, that is the HCWS. Why this topic matters? Healthcare workers, that is the HCW, face significantly higher risk of tuberculosis due to occupational exposure. TB is still a major global health threat, especially with rising drug resistant cases. Protecting healthcare workers means protecting their entire healthcare system. The global prevalence and risk factor for tuberculosis in healthcare settings. First, we will speak about the global burden. The WHO, that is the World Health Organization, estimates that TB affects over 10 million people annually. That is the incidence in general population. And the healthcare workers are 2 to 3 times more likely to contract TB than general population. Also, they are bound to get a drug resistant more than a general population. Like high burden countries, India, China, South Africa and Russia see frequent occupational TB cases. Risk factor for healthcare workers, prolonged exposure in hospital, TB wards, ICUs and laboratories, poor ventilation in healthcare settings, limited use of personal protective equipment, that is PPE, and delayed or inadequate screening among healthcare workers, immunosuppression, for example diabetes, HIV or malnutrition. So the transmission dynamic and occupational exposure. Transmission dynamic and occupational exposure mechanism. How TB spread in healthcare settings. TB is an airborne disease which spread through droplet nuclei from the patients during coughing, sneezing or talking. High risk area mostly are the TB wards, ICU, bronchoscopy room and laboratories handling Mycobacterium tuberculosis samples. Healthcare workers at highest risk. Doctor, nurses, laboratory technicians, radiographer and housekeeping staff working in TB endemic hospital. Those performing procedures like sputum collection, intubation, and bronchoscopy. So, what are the diagnostic challenges and screening protocol for healthcare workers? The challenges in diagnosing TB among healthcare workers. Symptoms like cough, weight loss, fatigue, or tiredness are often ignored or attributed to work stress. Fear of stigma and losing employment may discourage healthcare workers from reporting symptoms. Latent TB infection, that is LTBI, is common but goes undiagnosed due to lack of routine screening. Recommended screening protocol: annual or twice a year TB testing, tuberculin skin testing TST, or interferon gamma release IGRA, chest X-ray for high-risk healthcare workers, sputum microscopy, and gene expert testing for symptomatic workers, those who are having symptoms. Regular occupational health checkup for healthcare workers in high-risk ward. Personal protective equipment and infection control strategies. Role of personal protective equipment in TB prevention. N95 reduce TB transmission significantly when used properly. Gloves and gowns necessary for handling sputum and infected sample or materials. Hand hygiene and cough etiquettes. It is essential in limiting spread, infection control measures. Adequate ventilation, ensuring negative pressure rooms for TB patients, particularly drug-resistant TB patients. Ultraviolet germicidal irradiation and HEPA filter to remove airborne TB particles. Isolation of active TB patients and screening of close contact healthcare workers. Long-term health and career implications for infected healthcare workers. Physical health impact. TB can lead to long-term lung damage, reducing work capacity. Drug-resistant TB, that is MDR and XDR, has high morbidity and mortality. Also, mental and social consequences. Healthcare workers diagnosed with TB often face social stigma and discrimination. Mental health issues such as depression and anxiety due to fear of infecting colleagues or family. Career setback. Long treatment duration, minimum 6 months to 24 months, may lead to job loss or demotion. Financial burden due to prolonged medical leave and expensive treatment. Economic and systemic impact of TB in medical workforce. Loss of skilled workforce, TB related illness and death among healthcare workers, reduce hospital efficiency. Healthcare institutions spend millions on treating infecting infected staff, increase workload on remaining staff. Affected hospitals struggle with staff shortage, affecting patient care quality. Government and institutional costs. TB in healthcare workers increases healthcare costs due to treatment, compensation claim, and disability benefit. Prevention. Treatment and future recommendation for healthcare institutions. Prevention strategy. Mandatory TB screening at hiring and annually or twice annually for all healthcare workers. BCG vaccination for high-risk healthcare workers. Implementation of airborne infection control program, early diagnosis and treatment. Immediate initiation of directly observed therapy short course, that is the DOT, for having a TB in healthcare workers, ensuring free treatment and counseling to reduce stigma. Institutional recommendation. Health hospitals should have healthcare worker friendly policy for TB leave and treatment. Government programs should ensure financial assistance for affected healthcare workers. More research is needed on drug-resistant tuberculosis prevention in healthcare workers. So, in conclusion, final takeaway message: healthcare workers at the front line of fighting TB, but remain highly vulnerable themselves. Strengthening infection control, regular screening, and financial supports are critical. Protecting healthcare workers from TB is not just a medical necessity but a moral responsibility of healthcare institutions and government. And for the call to action, let us work together, physicians, policymakers, and hospital administrators to make TB prevention among healthcare workers a top priority. A healthy workforce means a healthy society. Thank you.